Hello guys, I hope you're well. So today we're going through some revision for the Gphc exam, and I want to quickly go through some hyperkalemia and what exactly is hyperkalemia. So when we talk about hyperkalemia, we are referring to increased potassium levels. That is obviously what we're referring to. But the important distinguishment is the fact that when we have hypokalemia can be treated by supplementation or through other means, and we're going to get to that. So hyperkalemia is caused by Ramipril, heparins, potassium-sparing diuretics, and other drugs, of course. And there are drugs that can cause hypokalemia as well. Now, if someone has severe hypokalemia, which can actually present as torsades de pointes, right? And I've seen exam questions ask about this. So it would ask which of the following drugs will cause torsades de pointes, and obviously that is just kind of severe hypokalemia. So an important point with hypokalemia is the fact that you can give IV potassium chloride for severe hypokalemia, and that's a very important point to talk about. So potassium chloride with sodium chloride in IV infusion is the initial treatment for the correction of severe hypokalemia and when sufficient potassium cannot be taken by mouth. So generally you would give a IV infusion of potassium chloride with sodium chloride to correct the hypokalemia if you cannot give potassium supplementation. That's a very, very important point. So also, when we look at the drugs that can sort of cause hyperkalemia or hypokalemia, we need to measure potassium as monitoring. So potassium chloride IV infusion is given to correct severe hypokalemia, especially when potassium supplementation cannot be taken by mouth. Now, the main reason why it won't be able to be taken by mouth is probably because obviously they could be vomiting, the patient could be end stage, could be terminal patient. So there could be many, many reasons why they cannot orally take sufficient potassium by mouth. So this is very, very important. Now, when we look at hypokalemia can lead to cardiac arrhythmias as well. And I'll stop it there. Thank you so much.